I'll go on and get started. Good afternoon. My name is Carly Jones. I am a current senior undergrad at Duke University, pursuing an individualized major that studies how childhood trauma impacts individuals and how this trauma is reproduced in communities. Today, I'll be presenting about resilient adaptation in maltreated children. And this was a project completed during a data science course I took last fall. This project was the collective effort of myself and my two teammates, Isaiah Mason and Roy Zhang, and it was completed under the guidance of our really awesome professor and mentor, Yue Zhang. Before we move forward, I wanted to also recognize the fact that child maltreatment is a really difficult topic that can bring up a lot of difficult emotions. And so if you at any point during the presentation find yourself feeling physically or viscerally activated by the content presented, then I just want to urge you to practice care for yourself in whatever way you need to. First, I'm going to discuss the background and motivation behind our project. Sorry, I'm having a bit of trouble going to the next slide. All right, here we go. Child maltreatment is defined as any act of commission or omission by a parent or other caregiver that results in harm, potential for harm, or threat of harm to a child. Acts of commission can include hands-on offenses such as physical abuse or sexual abuse, but they can also include more intangible things like psychological abuse. And acts of omission pretty much just include a failure to provide for a child's needs, whether those needs be physical, educational, emotional, and or medical. It is difficult to imagine that something this devastating can also be so quotidian, but it is unfortunately the case that in 2019, Child Protective Services substantiated nearly 600,000 cases of child maltreatment. This is undoubtedly a conservative number because not all maltreatment is reported to Child Protective Services. Out of these 600,000 cases, 1,840 were fatal. The outcomes following child maltreatment are overwhelmingly negative, with individuals who were maltreated struggling in the short and long term with things like depression, anxiety, post-traumatic stress disorder, suicidality, and increased participation in health risk behaviors. We know that our experiences in childhood are really powerful mediators of the lives we lead and the health we have. And so we also know that child maltreatment contributes significantly to adult morbidity and mortality in the United States. So the present project kind of grapples with where that leaves us if we know that child maltreatment is so devastating. So I think that a bit of like hope we have is that out of any population of at-risk children, we know that some are resilient or able to achieve positive outcomes in spite of severe adversity. And so I really think that that's our key here. If we can understand what produces a resilient individual and craft interventions following maltreatment that promote this resilience, then we have a shot at attenuating the poor outcomes and the suffering that often follows child maltreatment. So that brings us to something called ego resiliency, or an individual's ability to adapt to a constantly changing environment. Ego-resilient individuals demonstrate flexibility, resourcefulness, and adaptivity in stressful circumstances, and research has shown that ego-resiliency is predictive of resilient adaptation in maltreated children. So our project here is kind of asking, like, what then predicts ego-resiliency? So our research questions specifically looked at the associations of maltreatment status, the severity of maltreatment, and age of onset of maltreatment, as well as individual characteristics of withdrawal, aggression, and likability, and kind of seeing like how those correlate with ego resiliency. We hypothesized that there is a relationship between maltreatment and ego resiliency, that children who have been more severely maltreated possess on average lower ego resiliency, that children whose first maltreatment experience occurred later in life possess higher ego resiliency, and lastly, that ego resiliency is positively correlated with likability and negatively correlated with withdrawal and aggression. So next, I'll talk a little bit about our methodology. So our data set was called Longitudinal Pathways to Resilience in Maltreated Children, and we obtained these data from the National Data Archive of Child Abuse and Neglect. Our cohort consisted of low-income children ranging in age from 7 to 13 from New York, and approximately half of our cohort had experienced legally documented child maltreatment. Our really awesome data set included lots of variables, but the ones that are directly relevant to our project are maltreatment status, so whether or not a child has been maltreated, ego resiliency, which was rated on a scale of -1 to +1, maltreatment severity rated on a scale of 1 to 5, and peer ratings of aggression, withdrawal, and likability, as well as age of onset, so the developmental period where the first maltreatment experience occurred. And as far as our maltreatment status and severity analysis, we started out by visualizing the distribution of ego resiliency and kind of like stratifying it by whether a child had been maltreated or not. And then based on that distribution, we kind of used it to inform our 3 subsequent questions that we crafted and tested. So the first was, does ego resiliency differ based on maltreatment status? Is there a relationship between maltreatment and positive ego resiliency specifically? And whether more severely maltreated children possess lower ego resiliency. As far as age of onset, we started by visualizing the medians by developmental period, and then conducting a Kruskal-Wallis test to kind of ascertain whether there is sufficient evidence to conclude that there's at least one group difference in ego resiliency median by age of onset. And then as far as our aggression, withdrawal, and likability analyses, we started out by just calculating the point estimates for mean aggression, withdrawal, and likability between our maltreated and non-maltreated subsets, and then constructing our t-test to assess whether maltreated children indeed possess greater aggression, greater withdrawal, and lower likability than non-maltreated children. And we kind of wrapped up by constructing a linear regression model. And this was to kind of get at how we can quantify the predictive value of aggression, withdrawal, and likability on ego resiliency. So next, I'm going to talk a little bit about our results. We did find that maltreated children on average possess lower ego resiliency than non-maltreated children. However, there was insufficient evidence to suggest a relationship between maltreatment status and positive ego resiliency, and maltreatment severity and lower mean ego resiliency. As far as age of onset, we did not find sufficient evidence to suggest that median ego resiliency differed based on the age of onset. And then lastly, as far as aggression, withdrawal, and likability, we found that maltreated children do possess a greater mean aggression score, greater mean withdrawal score, and lower mean likability score. And as far as our linear regression goes, we found that ego resiliency is negatively correlated with aggression, negatively correlated with withdrawal, and positively correlated with likability. However, I think it's really important to note that in our linear regression, even though the aggression, withdrawal, and likability relationships were statistically significant, the relationship between maltreatment status was actually not statistically significant. So just in terms of takeaways, our findings support the conclusion that children who have been maltreated possess lower ego resiliency than children who have not been maltreated. But there is not enough evidence to uphold our initial claims that maltreatment status is correlated with negative ego resiliency levels, that younger age of onset correlates with lower ego resiliency, or that more severe maltreatment correlates with lower ego resiliency. And then as far as our linear regression goes, according to their peers, maltreated children were more aggressive, more withdrawn, and less liked than non-maltreated children. And this finding is particularly sobering because the aggression, the social withdrawal, and decreased likability attributed to maltreated children by their peers places them at significant risk for peer rejection, which in turn correlates with psychopathology, delinquency, and other kinds of things that indicate poor long-term adjustment. And so it's clear that maltreated children are at incredible risk following their maltreatment, well, during and following their maltreatment experience. But maltreated children who are perceived as more aggressive, more withdrawn, and less liked by their peers are at the greatest acute and lifelong risk. Having identified this risk, it is our responsibility to intervene with protection and make these children a first and foremost target of intervention. So there are a few limitations to our analysis, like we can't really ascertain effect size, we didn't look at gender, the form of maltreatment, or the duration, and because this is observational data, we can't really make any causative inferences. But in terms of future directions, research shows that boys and girls occupy vastly different social worlds because of their gender, and that these social worlds have different kind of etiologic risk associated with them. And so it stands to reason that any successful intervention following child maltreatment has to be gender aware. And so I think that like accounting for gender in future analyses is a really like rich and important target of study. So I think that wraps it up. Thank you so much for your time and attention. And I don't quite see the time, but I'm sure I'm over time. So apologies for that. Thank you.